And I think some of the statistics around this are really interesting, where people who do have sort of this imaging, or the X-rays or CTs or MRIs that are taken of the joints, they have findings that are consistent with what you would predict to be osteoarthritis, but they have no symptoms. They're asymptomatic. How common is that? We've talked about that with like low back pain and herniated discs, for example. That 40% of people over the age of 40 are going to have a herniated disc, and they have asymptom. They don't have any symptoms, right? Well, what about in osteoarthritis? Is that a similar finding?
Yeah, it's a very similar finding. And there's not one statistic that I could give you because this graded increase across the lifespan is pretty typical. So, as it's almost like it follows the age in number in terms of the percentage likelihood that we would see radiographic findings like this on your imaging, independent of whether or not you have symptoms. And so that's kind of what I was alluding to earlier, is that the diagnosis is not one that you can make purely based on x-ray. I've seen some what you would call quote unquote horrific looking x-rays that look real bad, and the person's feeling fine and doing fine and has no complaints. And other ones where they had pretty debilitating symptoms and maybe it didn't look quite as bad. So there's a significant discordance there, but it's not a complete discordance. It's not completely unrelated. As I said, there is a role for structure and some underlying biology and mechanical factors here as well. So when those kind of studies are done, they're usually looking at widespread, comparing people to other people, and trying to correlate the severity of findings versus the symptoms that they report. There have been some interesting studies that have been done within people. So, for example, looking at one person's, if they have osteoarthritis in one joint, looking at that joint versus the same joint on the other side of their body. So one knee versus the other, for example. And in that situation, which kind of helps to control for some of the confounders, or the mediating variables, other things that can influence the pain experience between people within one person, one joint versus another, there actually does appear to be a little bit stronger of a relationship between the two. This was an interesting study by Dr. Niyogi in 2009, who is a major player in this world of osteoarthritis and rheumatology. And we can provide that study in the show notes because it was an interesting one to kind of temper your discussion around the idea that, like, what's the significance of imaging findings. It seems that population wide between people, very, you can't look at a scan and predict whether somebody has pain or not, but to the point that there is some relevance of structure and function and things like that in the joints, between joints within the same person, there's a little bit of a stronger correlation. But ultimately, how do I communicate this with patients? This is a common framing that I'll provide when I'm having these conversations, just saying something as simple as two people can have the same changes on an x-ray, but they experience the effects very differently.